Now we will have, I'm delighted to present my colleague, Dr. Mohsen Ahmed Abdul Mohsen, and he's an associate professor in our department. And his topic today, and will be the final topic in the scientific session. After that, Dr. Abdulaziz will give us his conclusion about the conference. His topic is extranodal lymphoma, PET-CT can help.
Thank you, my professors and colleagues. I have the honor to introduce to you my presentation about extranodal lymphoma, PET-CT can help. Lymphoma has different classification system, either pathological classification, histopathological, and imaging, and we can classify lymphoma into either nodal lymphoma or extranodal lymphoma. And even extranodal lymphoma could be classified into extranodal lymphatic and extranodal extralymphatic. By definition, extranodal extralymphatic involving lymphoma in sites other than the lymph nodes, the spleen, thymus, and pharyngeal lymphatic ring. The Ann Arbor staging of lymphoma and its modifications, or trying to answer the question how the lymphoma spreads in different tissues of the body. It is a systemic disease, so we want to know if it is a stage 1 in one nodal group, or more than one nodal group to one side of the diaphragm, or more than one nodal group to both sides of the diaphragm, or extranodal infiltration. And the reason for this classification is to know that treatment, what is the decision to make. Whenever we have a limited stage 1 and 2, radiation therapy is more favored and is more suitable. Whenever we have a systemic disease or advanced stage, so systemic chemotherapy plus or minus radiation therapy will be more beneficial for the patient. And we have different pathological types of lymphoma, including aggressive and non-aggressive and indolent. So it is not surprised that we have different SUV mix in between different lymphoma patients, to the extent that we have in marginal zone lymphoma and follicular lymphoma, we don't have even SUV uptake at all, and it could be differentiated in both in the differential diagnosis of false negative PET-CT data. The basics of PET-CT was discussed before in the previous talks. We can measure the accumulation of the radio tracer by two methods, either the visual assessment method, and it is easy to say in these patients that the splenic uptake is more than the surrounding background, and even within the splenic uptake, we have a focal uptake, focal splenic regions within the diffuse splenic uptake. So we can know that there is a splenic uptake and focal splenic regions on top of this splenic uptake. The other method is the semi-quantitative SUV value, and there is a cutoff point of about 3. What is above 3 is towards malignancy. Also, the Diouville criteria was discussed in depth in the previous talks. The aim of our study is to demonstrate the effects or the added effect of PET-CT in staging of lymphoma and differentiation of nodal and extranodal disease for more staging of lymphoma. Now to case presentation. Case number 1. 40 years old male patient with history of non-Hodgkin lymphoma presented by bilateral adrenal masses. In the CT image, we have bilateral adrenal masses of different densities. In the PET image and the fused PET-CT image, we have avid uptake in this bilateral renal masses in a patient with history of non-Hodgkin lymphoma. The SUV measured was about 14. 6 months post-treatment, there is no uptake in the PET image and no uptake in the fused PET-CT image, denoting adequate response to treatment of these adrenal lymphoma patients. Case number 2. 50 years old female patient with cervical nodal lesion pathologically proven to be non-Hodgkin lymphoma. In the PET image, we have avid uptake in the left iliac bone and to a lesser extent the right iliac bone. And in the corresponding CT image, bone window and soft tissue window, there is lucences within the left iliac bone and proved by bone marrow biopsy to be lymphomatous infiltration. This is extranodal bone marrow infiltration. Case number 3, 45 years old male patient with pathologically proven Hodgkin disease, and we have the avid uptake in the fused PET-CT image with mediastinal nodal uptake, and bilateral batches of consolidation with mild effusion. These batches of consolidation showing avid uptake in the PET image and the fused PET-CT image with SUV10, denoting parenchymal pulmonary infiltration by lymphomatous infiltration. Case number 4. Mucosa-associated lymphoid tissue lymphoma proved by endoscopic biopsy. It is a single extranodal site, so the stage is 1E, the suffix E for extranodal. And we can see in the PET and the fused PET-CT image, there is marked mural thickening forming a mass in the rectal curvature of the stomach, in the body of the stomach, with SUV20 and endoscopic biopsy proven to be mucosa-associated lymphoid tissue lymphoma. Case number 5. 50 years old female patient presented by bilateral breast and axillary masses. The initial diagnosis was breast cancer with nodal deposits. So the next step was to do biopsy from the breast masses. Biopsy showing lymphoma. This is lymphoma, small lymphocytic lymphoma in the breast and the lymph node. So the next step was to do PET-CT to know the staging of this lymphoma. PET-CT showing breast parenchymal infiltration and axillary lymph node, as well as bilateral iliac lymph nodes exerting mass effect on the bladder and inguinal lymph node. So we have nodes above the diaphragm, nodes below the diaphragm, and we have extranodal breast parenchymal infiltration. So this is a stage 4 disseminated disease. In conclusions, PET-CT is accurate for baseline staging of nodal and extranodal lymphoma and to determine the appropriate decision making in the treatment, either radiation therapy or chemotherapy. It is used for evaluation of treatment response and can detect the residual malignant lymphomatous infiltration with greater accuracy. It is also suitable for choice of the biopsy site because in lymphoma patient, it is a systemic disease. We have cervical, abdominal, thoracic, extranodal infiltration. So the choice of the biopsy site sometimes is challenging. The highest SUV is the highest maximum tumor activity. It is the preferred site for biopsy. PET-CT findings influence the decision making about the need for additional or change the treatment option. And here is our published article. Thank you.
Thank you, Dr. Mohsen, for your nice presentation. But as I would like to ask one question about the frequency